Hello everyone, it's May 30th, 2016. My name is Ahmed. I was diagnosed with smoldering multiple myeloma back in November 2015. If you see my first video, which I explain my story or my experience with the bone marrow biopsy, and that was recorded back in January. It was confirmed that I have a smoldering multiple myeloma. Before that, I had the symptoms for over 2 years, same symptoms, and doctors kept referring me to specialists. I went to allergy because I had some rashes. I went to neurology because I had a lot of neuropathy problems. Until my general doctor noticed that I had excessive protein in my urine. So he did some blood work and he told me I have to see a rheumatology. Well, that was back around October last year. And eventually that doctor, which I owe him a lot, he was experienced enough to notice that I either have one of the three diseases, which is multiple myeloma. I have MGUS, which he thought that I pretty much have MGUS or amyloidosis. And he said, okay, well, to be 100% sure, you have to see a hematology. So he referred me to a hematology who first he said most likely I have multiple myeloma, and it was confirmed with the bone marrow biopsy, which I've done in January 2016. Now, I prefer to wait to record my first video after my 3-month blood work, which was done in that was done in March 31st. So, and I've seen my hematology like about 2 weeks after that. And basically I want to tell you a little bit about what happened in around October. My main symptoms was that I feel in fatigue for the past 2 years. I know myself, I practice sport a lot, I jog every day, I do a lot of gardening, and all of a sudden I'm not able to do the same thing that I used to do. I'm 49 years old, by the way, okay? About 1 month I'm going to be 49 years old. So, I'm not able to do the things that I used to do. But my fatigue was though like super abnormal. Like, for example, I would drive for like an hour going to another city, and after almost like 30 minutes I have to pull over and take a nap. It was super abnormal fatigue. I would, for example, work in the garden. After almost like 1 hour, I ran short out of breath, and I have to take a rest. I have to take a nap. I was feeling lazy. Just like let's say I used to forget a lot. I had would feel like some electric shocks, which I found out like some later that all the multiple myeloma patients have some sort of nerve damage. And I have very stiff muscles around my neck. I also have some back pain, so it was all related. That's why it was very hard. And of course, if you know, MGUS and multiple myeloma are very hard to diagnose, and you don't find that unless your doctor saw some urine or some blood work which was abnormal, which that's what happened with me. So as soon as the rheumatology started to suspect and I had my first blood work back in, it was exactly in November, that's my hematology, I'm sorry, back in November 19, okay? So I had my Lambda Light Chain free, and my measurement was 1026. Now the reference or the normal person is 5.7 to 26.3, and mine again was 1026. Of course, that's like way too high, and now it depends what's your diagnosis with the MGUS or the smoldering multiple myeloma. This is the key factor in measuring your disease. And by the way, my 3-month showed my value was 883.4, which about 14% less. I mean, it's still too far away from a normal person, but hey, I got an improvement of 14%, which that means my diet and my supplement lifestyle is working. All right, so back to November, after my hematology almost told me that I have MGUS. I went to Dr. Bittker. He's a local. I live in Tampa, Florida, by the way. So Dr. Stephen Bittker, I have been seeing him for the past, at least me and my wife, for the past 10 years overall for general health. And I took my blood work, and he recommended some supplements. And I'm gonna mention them here in the description of the video. Later I'm gonna record some videos, individual videos about the benefits of each of these supplements. In addition, I have one of my dearest friend who is a retired homeopathic, and she used to be one of my customers in my store in Sarasota. So anyhow, I took it to her, and immediately she suggested a diet. Well, basically just like any other cancer patient, I have to stop sugar. That includes also fruit. I have to stop eating meat, chicken, eat only like seafood. I have to follow a lot, and I had to juice a lot of greens. Now, not every greens, but that basically like the crucifers family, like the cabbage and the some others also. Again, I will discuss in very details. So overall, at the same time, by the way, back in November, at the same time I was diagnosed with the smoldering multiple myeloma. I was diagnosed with upper stomach inflammation and also bad acid reflux. My symptoms also were so bad that I used to eat anything, I would cough right away. I had to take the enzymes, the digestion enzymes, with each meal that I take. I had to take probiotic. I'm completely off right now. I don't take any probiotic, and I use my my fermented cabbage juice. And again, I'm going to provide the link on how to make the fermented cabbage juice in my description. So overall, don't give up. By the way, my myeloma cells, when I've done the bone marrow biopsy, myeloma cells, it shows that I have 25 to 30% in my bone marrow. So I was almost close to the stage 1. But anyhow, when I saw the hematology back in January, he said, okay, well, there's no any medications for you right now. All we have to do is monitor your blood work, which is it was pretty much a let's say a statement I was expecting. I mean, taking medication is my last really let's say, option. I don't like to take medicine. My body is very, very sensitive to any synthetic medications. I don't like to take anything even over the shelf, over the counter, pain relievers. I don't take all this stuff. So anyhow, I'm gonna again make some other videos which shows in details the diet that I was following, all this I'm still also following, and also the type of medications, they're all natural, by the way, that I have been taking since last November. All right, feel free to ask me. Please join my Facebook group to discuss later, to tell me about your disease. We're all here in the same page. It's me and you and everybody else. And hope you feel better. Don't give up, okay? Health is on the way. Alrighty, see you in another video. Take care.